When we say patient safety, we are concerned with decreasing the potential for having patient errors. Our goal is to provide quality care that's always correct, and we have put in many measures into place to provide for the safety of our patients. One of the big things that we have done is instituted hourly rounding by the patient care staff, so that every hour there's literally someone's putting eyes on the patients to make sure that they don't have any needs that would potentially make them get up without assistance, which puts them at a risk of falling. So at shift change, the nurses as well as the PCTs are giving report to each other in the patient's room at their bedside, and it gives them an opportunity as a group to look at the IV site. Are the right fluids infusing? Is the patient doing okay? Has there been a condition change? And it also gives the patient or their family member who might be there an opportunity to participate in their care for the day. Some of the things that we have in place now are projects to prevent falls, to improve communication, and a big focus on medication management. For medication management, one of the first steps we take anytime a patient enters to the hospital is to compile a list of their home medications. And it's very important that the patient or their family member has that accurate information. We're looking for their medication name, their dose, when they take it, and when they last took it. Then the physician looks at that medication list and determines what medications need to be continued or discontinued by the patients in the hospital. A pharmacist also takes a look at those meds and is looking for things like contraindications or side effects that might be causing a problem for the patient. On a daily basis, we take a look at patient care through the chart. This often occurs after the patient's already been discharged. We dig deep into the chart to make sure everything's documented appropriately, to identify if there's any room for improvement, and then we act upon anything that we identify so that the next patient, the community as a whole, benefits from any information that we obtain. The quality department is very involved in collection of data that is required to be reported to Joint Commission and the Centers for Medicaid and Medicare Services. We are very detail-oriented in collecting that data so that what we present is accurate, because it is available to the public. So it's vitally important. But we also utilize that data to identify areas that we can make improvements on. The thing that I'm most proud of with patient safety and quality is the fact that we are continuously striving to identify ways that we can make improvements. Houston Healthcare in recent years and continuing to do so are making many developments and improvements to bring better technology and expansion of services to our community so that people do not have to leave their hometown to seek health care.